be open-minded and have a positive attitude, and that will get you so far in nursing school. Hell, that will get you far in life, okay? Hey guys, my name is Lakeisha and welcome to The Right Nurse. In today's video, I'll be discussing the top 5 nursing school must-have supplies. If you would like to know what those must-have supplies are, please continue watching. Alright guys, I'm just going to jump right into it. So the first nursing school must-have supply is a stethoscope. A stethoscope will be used to perform many of your assessments, such as a head-to-toe assessment, to listen to the heart and lung sounds, and also to perform manual blood pressures. Most nursing school programs will require you to purchase your own stethoscope and blood pressure cuff. I purchased mine from Amazon. The one that I purchased was the Lippmann Classic 3. It was a relatively good price on Amazon. I love it. They come in so many different colors and different designs, so I would definitely just go to Amazon. All the products that I list in this video will be in the description box below as well. But for the most part, I will say a stethoscope is probably like #1 thing that you will need and is essential for nursing school. Alright, so the #2 nursing school must-have is a clipboard. Now, a clipboard is mainly used for the clinical setting, but what I would say is very beneficial to have. I would recommend a clipboard with storage. So this is a clipboard that I purchased from Target. It probably was like $10. It really didn't cost me much. But with this clipboard, as you can see, it opens up. It has additional paper here, and I can put all my clinical paperwork there. It's really important to keep everything in one area because you will have a lot of papers with you, such as the patient's report sheet that you got from the nurse. You'll also have your med sheets and just additional clinical paperwork. So to have everything in one area is great. And then it makes it helpful because you are able to take your clipboard into the patient's room. So it's a lot easier to jot things down that you find in your assessment. So you won't have to like try to remember everything or try to write something down on a little sticky note. You'll have your clipboard, you go in, you go out. It makes stuff so much easier, especially in a clinical setting when it's a lot going on and people everywhere. So I would definitely recommend a clipboard with storage. Alright guys, so third on the list I would recommend is having a watch with a second hand. Not just any watch, but a watch with a second hand. Now this will make your clinical experience in life so much easier just having a watch. Because many times I walked into patients' rooms, the clock isn't visible where I can see it, or it's not working, or there's no clock at all. So you will need a watch with a second hand to pretty much count respirations and pulses. Now, in the beginning, I was using my Apple Watch. Now, I love my Apple Watch. It has a clock on there, and it also has a stopwatch as well. The annoying thing about the watch, my Apple Watch, though, is that I had to keep flipping my arm for it to stay lit. So if I'm trying to count respirations for a full minute, after 30 seconds, the watch will stop being lit, and then I'll have to flip my arm again for it to be lit, and it was just really annoying. So the watch that I ended up buying was a Casio. Now, I don't know if I said that right, so don't crucify me in the comments, but I got this off of Amazon. It was only like $18. I would definitely recommend this watch. 1, it was cheap. 2, it has military time on here, so I didn't know military time, honestly, until I started nursing school. I had no reason for it. So most nursing school programs, most hospitals and nursing homes, they all use military time. So instead of saying 4 p.m. it's really 1600. At first that was hard for me to grasp. Like when I tell you I took it old school and had to keep counting on my fingers to figure out what time it was. Yeah, until I learned it. So I would definitely recommend a watch with a second hand, but I would definitely recommend Casio, this watch, just because it has military time on there. So it was really helpful and it's really affordable as well. The fourth nursing school must-have supply is this Davis's Drug Guide book for nurses. When I tell you I love this book, I live by this book, especially for when I was in clinical. It gives you like a ton of information. Like it tells you what to assess for before administering the medication. It also tells you what the drug and food interactions are. It gives you the safe dose ranges as well. It's definitely important to know or at least have a general idea of the medications you're administering. There's been plenty of times my patient had questions about the medication I was giving them, and I was able to answer those questions. It's nothing worse than not knowing what the hell you're administering. It's like, how are you going to administer something you don't even know what it is, what it does? Like, patients will lose faith in you quickly. So it's definitely important to know, like, a general information about the meds you're giving. This is also great for med sheets. I don't know about other nursing school programs, but we had a complete med sheets on every medication that our patient was taking, and sometimes they would be taking like 15 meds or more. So this was definitely helpful. I live by this book. This book went with me to clinical, went with me to class. It's pretty small. It's kind of a little heavy, but honestly, I live by this book. And the good thing about this book is that it actually came with a online code, so I was able to pull this up on my cell phone if I needed to. But yeah, I would definitely recommend this baby right here. I'm pretty sure you can buy it at your school store or Amazon. I brought mine at my school store, but it's relatively inexpensive, so I would definitely recommend this here. Alright, so the fifth thing on the list is pens. I know you guys are like, really, pens? However, you're never going to write anything in pencil, especially in nursing school or in a clinical setting. You're always going to use a pen that's either blue or black ink. Now, I say pens because, and I say with an S, it's really important to have multiple pens with you. There's been so many times I will leave my pen at the nurse's station and I look up, it was gone. Doctors and nurses will request to borrow your pen and it was gone because they never gave it back. And then sometimes patients will like to use your pen for something or to write something down. And depending on the situation, you're not going to want that pen back. So if you're anything like me, if you guys ever seen the show Monk, it's like a show from back in the day. I'm like 70% like him, kind of like a germaphobe. Like, I only like to use my pens. I like to alcohol my pens down after clinical, so sharing my pens with like patients and all that stuff just doesn't work for me. So I always have multiple pens with me, whether I'm at clinical, lab, you name it. I always carry extra pens because, like I said, they will mysteriously disappear and you won't see them again. So it's important to just make sure you always have a pen with you. They're just important and essential for school. Alright guys, so the 2 bonus nursing school must-have supplies, these are intangible, okay? It is important to have an open mind and a positive attitude. When I tell you just being open to new people, new concepts, new subjects, like nursing school will open you up to so much, and it's important to just be open, especially to constructive criticism, because your nursing school instructors will criticize you. Now don't get me wrong, like they mean well, but they will criticize you to the T, but they have to. They're trying to push you to be better, to be the best that you can be. I know that sounds kind of cliche, but they really are. So you can't take it personal. You just can't. Even when patients, like sometimes patients don't want a student nurse, or they really don't want to be bothered, or they're in pain, but you just have to be open to view it from their view. See it through their eyes, what they're going through. It's just important to just be open and to have a positive attitude, because being negative Nancy or negative Nathan is not going to get you anywhere in nursing school, okay? It would actually make your life so much harder. I definitely recommend just being positive. Even when it starts to get tough, it gets hard, keep a positive mindset. You don't want to reflect negative energy into nursing school or to your instructors and your classmates. It just will make the experience miserable in the long run for you, and you may not even succeed if you end up having like a negative attitude. One thing I like to say is you get more with sugar than you do with salt, so definitely be open-minded and have a positive attitude, and that will get you so far in nursing school. Hell, that will get you far in life, okay? And if you guys would like to see the supplies I brought for my second semester, please stay tuned to my next video, and thank you guys for watching. Peace.